Sorry, I'm gonna stop sharing so I can make sure it's recording. Oh, it's already recording.
Okay, I'm gonna start admitting. Hello, good morning, everybody. We're going to take some time at the beginning to just let people trickle into the meeting. And in the meantime, I'll just do some brief introductions, introduce our speakers and the topic. For starters, I'm really glad you're here. For starters, my name is Alexandra, and right now I'm supporting the marketing and communications aspect at Port Credit Therapy Center. I'll be your host for today's session. And before we begin, just a few quick notes. This webinar is being recorded. And a replay will be shared with everyone who registered afterwards as well within 24 to 48 hours after the presentation. We'll also have some time for questions at the end. So if a question comes to mind, even in the middle, beginning, at any point in the session, feel free to drop it into the chat function. And we'll return to it towards the end. So just so we can get a sense of how many questions there are and what's top of mind for you, feel free to just start loading them into the chat. And also, if you feel comfortable, you're also welcome to keep your camera on. We always love seeing who's in the space, but of course, there's no pressure. I also want to take a second to introduce the topic. Today's session is an introduction to the co-care model, which is a framework designed to support therapists and wellness practitioners in thoughtfully integrating psychedelic-assisted therapy into their work and their practice. We'll be exploring different ways you can be involved, whether that's through referral, adjunct support, or more active participation, all while staying aligned with your scope of practice, your training, and your comfort levels. As many of you know already, psychedelic-assisted therapy is continuing to emerge as a meaningful option for clients navigating treatment-resistant depression, anxiety, and trauma. And with that, there's also a growing need for collaborative, ethical, and well-supported care models, which is exactly what today's conversation is about. I'm really happy to introduce our speakers for today. First, we have Dawn Binkowski, the clinical director of Port Credit Therapy Center and a registered psychotherapist. Dawn has been involved in developing and supporting psychedelic-assisted therapy programs and bring a strong trauma-informed and integrative lens to this work. We're also joined by Harpreet Lakan, a registered nurse and operations manager at the clinic. Harpreet plays a key role in the delivery and coordination of our psychedelic-assisted therapy programs and brings a grounded, compassionate approach to client care and clinical support. Together, they've been instrumental in shaping the co-care model and the way that they approach this work at the clinic specifically. And with that, I'll pass it over to Dawn and Harpreet to guide us through today's session.
So, hello. It's nice to see some familiar faces here. So yes, psychedelic-assisted therapy. Who knew? I'll tell you just a little bit about how I got into this myself. Is it possible just to put my face up rather than the meet your speakers thing so that it were a little more, I'm not technical at all. So if it's not a possibility, then don't bother. I'll just keep talking. So about almost exactly 3 years ago, I was looking for a new training opportunity, and a colleague of mine said, hey, I'm doing this training called the Ketamine Learning Experience, and it is for healthcare providers, and it is run by a psychiatrist and a nurse, and they are both therapists, and it is experiential. We actually get to try the medicine. So I went for this 5-day residential. We did a low dose of ketamine. We did a day of holotropic breath work. And then we did a day of high dose ketamine, alternating with the next day. Then we were a sitter, or alternating that. We were a sitter for someone else doing a high dose journey. And after that 5 days, I decided instead of getting ready for environment, I needed to decide this is a treatment modality because it was next level. It wasn't only my own experience from it, it was also the experience that I heard from 13 other people, psychiatrists, medical doctors, therapists, underground practitioners, all talking about what their experience was with this medicine and altered states of consciousness. And I instantly recognized the therapeutic potential of this. I then have I've done intensive training since then to become to advanced psychedelic-assisted training from a variety of different places. The main one being at Messina, who we are a member clinic of. And I expanded my clinic, got a medical team together. Through the direction of at Messina, they helped me meet regulatory compliance to be, I think it's something like an off of hospital clinic, so that we could serve medicine. And as you know, I have 2 nurses that are working with us, and we have an MD who is also our medical director. And this is all about so that we are able to provide this treatment modality from a very ethical, trauma-informed place. I'll tell you a little bit about, one of the experiences that I had in that first 5 days, which will give you a sense of what this medicine is capable of doing, is when I was in a high dose ketamine experience, all of a sudden I could feel my body starting to rock. And what that ended up being was my body was completing the process of natural childbirth. Hadn't been able to do. My mother had been born by cesarean section. And this was something that I had no clue about, that wasn't, sitting around that I was thinking about that, 30 some odd years ago. But my body had still been holding on to the fact that it hadn't been able to complete that process that it hadn't gotten ready to do. So this is just giving a little bit of indication that there's a lot of stuff that we're holding on to, either a body memory or something that's buried, that, I guess, just repeating myself, that our body is holding on to, that the psychedelics can allow us to have a release with. Yeah, I also just want to say that this webinar is for educational purposes only. We're not giving medical advice in any way, and that it is really important in this whole psychedelic field that practitioners are engaging with safety, ethics, and collaboration. A very important part of psychedelic therapy is building the trust container and what's called set and setting. We need to be able to feel supported and safe in order for the survival mechanism part of ourselves to be able to sink into the medicine and allow ourselves to have the full experience. And this is part of the difference between a recreational trip and a therapeutic experience. This is done with support at all times, from a trauma-informed approach, so that the client is recognizing that there is safety and support available to allow them to go deeper. I know that in my practice of being a therapist for a few decades now, that there has been a certain percentage of my clients not reach the level of healing that they have wanted. They can get support from therapy, but then the next time they feel better, but then the next time something happens, they have a trauma response and are right back down in that pit again, or escalated way up here. And that's despite working on it in therapies, working with it somatically, working with it with the trauma-informed approach. Typically, they've tried medications before. the general statistics that are out there is about 10 to 15% of our clients don't reach that same level of wellness. And what the field of trauma research has shown, as well as absolutely the field of psychedelic-assisted therapy, is that there's trauma at all different levels that we can be holding on to. A precognition trauma, such as early childhood, birth trauma, in utero trauma, even conception trauma in the case of a sexual assault. We also now recognize that intergenerational trauma we can be holding on to, as well as even ancestral trauma. And I know that prior to me undertaking all of this training and having these experiences myself, I might be going a little woo-woo when I hear some of these stories, but I've experienced these things myself in my exploration of these medicines. And there's a way where you get a felt sense of what's happening through a psychedelic journey that feels different than just knowing about something. I also will say that some people have some mixed feelings about psychedelics. Thank you, the war on drugs back in the 60s and 70s, which primarily was politically motivated. There was tremendous research being done with psychedelics back then, but it all was shut down, unfortunately. Some practitioners continued underground. But when you look at it historically, indigenous cultures worldwide have typically been using psychedelic substances in ceremony and ritual for many, many generations. And typically, indigenous cultures that haven't been interfered with colonization tend to have a lower rate of trauma and anxiety and depression. Part of it is living in community will be a piece of this, but also ceremonially taking psychedelics together help them to work through whatever it is that they need to process. And that's why it's really important what's happening in the psychedelic field, where there is this coming together of Western medicine, allopathic root, and indigenous knowledge, so that we can each learn from each other. And that's part of what we're doing here at the center in psychedelic-assisted therapy, is we're getting a hybrid. It's not totally a medicalized model, because we also are bringing in a trauma-informed approach, and also with some ritual in a way, where we will read poetry while a client is waiting for the medicine to take effect. There is a very soft container that we build for the clients. Clients are welcome to bring in important items for their journey that we can set up for them. All different ways that we're trying to blend the two, so that we're moving away from the medical model of, I'm the doctor, I'm going to diagnose what's going on with you and then tell you what you need to do to feel better. One of the problems with that is it's disempowering for the client. And another area that we become aware of through psychedelic-assisted therapy is we have what's being referred to as an inner healing intelligence, that there's a part of us that knows what we need in order to reach a higher level of wellness. And the psychedelics allow us to tap into that. So, okay. Now, relating to the fact that we can be doing great therapy with clients, but still they're unable to reach that level of wellness that they've been hoping for. And it doesn't mean that, that we're a bad therapist, and some clients will also just plateau. They reach a certain level, but then aren't able to embrace the healing and put their own supports in place because they're thrown right back into a trauma response. So this is why this model that we have now is such a wonderful opportunity for therapists to continue to support their clients when the clients have hit a wall. So I'm looking at the slide here. Yes. So it's access beyond the cognitive layer. And also, though, even if there is a cognitive layer, that we know why we are doing something, but we've been unable to shift that behavior. Often what materializes after a medicine session is there's a different way of knowing. There's a felt sense of knowing in the body as to what the trauma is about. And so that we're better able to look at it differently and release it, as opposed to getting stuck in the familiar ruts that we have been reinforcing over and over again, an anxiety rut, neural pathway, or depression, or trauma response. Nervous system and emotional processing, this happens easier. What these medications can do is it can blunt our fear response. So, and many of them also activate empathy and compassion, including for self. So with the blunting of the fear response, the amygdala response, then we're able to revisit a previous trauma, if that's what's coming up, without feeling like we are in the middle of it again and re-experiencing the trauma. We're able to go through it with a lot of emotion, but it feels cathartic, as opposed to, oh my gosh, I'm experiencing this trauma again. And this is part of the imprinting that's happened, that our cells have been holding on to ever since that trauma happened. And that even includes intergenerational or ancestral trauma. There's a way that our cell biology has been altered by traumatic events of our ancestors that has then become part of our survival mechanism, and where we're scanning for danger. What is really important in the field of psychedelic-assisted therapy is the recognition that the medicine, the molecules, whether it is ketamine or psilocybin or MDMA, which is what's legal here in Ontario, is it's just the lubricant. It's the integration therapy work that happens during the medicine sessions and afterwards that leads to sustainable change. Otherwise, it can be sort of like a dream. You remember it immediately after, but then it starts to fade into the background. And what we want to do with psychedelics is we want to take the insights that came up, that we gleaned from the medicine session, and take action on them in order to create the sustainable change. There's a saying in the psychedelic world about how to make the extraordinary ordinary. So you still have to do the work, or the client still has to do the work. This is not a quick fix situation. So I'll give an example now of, yeah, great, good timing on the slide there. That this is an example of a client that I worked with. Well, first I'll just pull back a little bit and just explain that ketamine is the main medicine that we are allowed to use. And that is, a doctor is justified in writing a prescription for ketamine if there is a treatment-resistant anxiety or depression or trauma. Treatment-resistant meaning that typically they have tried therapy, different modalities of therapy a few times, and have tried pharmacological support. Now, it isn't a hard and fast rule that if someone has strong resistance to trying antidepressants, but they have tried other ways of trying to find support for themselves and it hasn't been effective, or they have really been doing therapy work, again, not able to reach the level of wellness that they were hoping for. We have assessments called measures that we can send to a client that is a very short assessment that scans, that assesses for anxiety and depression and trauma. And if someone is scoring high enough on those, or alternatively, we can tell there's a trauma response, then there is another quite fulsome assessment form that can be filled out that assesses for PTSD. Those can be gateways to have about this being an appropriate treatment model for your clients. So back to ketamine. That is the one we use primarily. And with ketamine, there is the opportunity to do both a high dose or a low dose. And with a low dose of ketamine, it is a low dose of ketamine and a 2-hour talk therapy session. And what that does is the low dose of ketamine tends to give access to deeper information in the unconscious or subconscious even, and a different way of experiencing trauma. And when I talk about trauma, I'll talk about developmental trauma, just from the point of view that we all have adapted some way from childhood that made us contract from our most authentic selves. And so we all have some way that we have adapted to our family environment that may not be serving us as an adult. And then the other form of ketamine that we can do is a high dose of ketamine. And a high dose of ketamine is an invitation to go inward. And a higher dose, the person is given headphones, and there is a curated playlist that is chosen. Again, it's an invitation to the unconscious and subconscious. And they have eye shades on, and the person is typically in the experience. And the therapist and we have a second person with high dose called a compassionate witness. So there are two people there holding energetic space for the client while they are in a high dose journey, and available should the client come out and need some support, or they're going through a challenging part of the medicine session and they need some support. So these are the two models that we have. Back to the low dose. This is something from one of my own medicine sessions with a client. It was a low dose session, and she's somebody that has suffered from social anxiety pretty much ever since she was a teenager. And what happened through the medicine session is all of a sudden she was able to connect that the reason she was socially anxious was because she heard her parents gossiping and judging other people her whole life. And while she knew that was a factor in her concern about other people's judgment, she got this felt sense of it. She said, in the session, she said, "Oh my gosh, that wasn't mine. It was theirs." And she did this hand motion of letting go of it. And there was a release that she felt. And in the integration session that we did afterwards, I invited her to repeat that hand motion, and she was able to feel that release in her body and that letting go of it, and recognizing that it was something that she had swallowed from childhood and no longer had to hold on to. And that was in May last year. And she did one session, which is unusual that one session can have such a big impact, but she has not experienced social anxiety since. So almost a year. So just giving a little indication of how powerful this can be. Yes, so there's a different way of feeling it. A felt sense is how I can describe it, and how other people have described it that have been through this. Okay, so just to underline this, that psychedelic assisted therapy, it doesn't replace therapy. It is a good adjunct to it and allows for deeper processing that regular therapy, whether that's talk therapy, somatic therapy, or even EMDR therapy, haven't been able to get to the root of. Okay, so now what I'm going to talk about is the co-care model. So as I mentioned at the beginning, we are a member clinic of Atmosina, and Atmosina is a company whose mandate has been to facilitate. They opened up 2 ketamine clinics of their own in Alberta. They're based in Alberta, and then they have been helping other clinics, such as our clinic, to become a member clinic to be able to offer this treatment modality. It was quite a process in order to meet regulatory compliance and getting a medical team together. And that can be prohibitive for many people. So part of what Atmosina has done is come up with this co-care model where you are able to refer your client to us for the psychedelic assisted therapy portion and be involved at different levels, depending on what I'm going to go through, your level of experience. And it's taking advantage of our infrastructure that we have in place, and with a heavy focus on continuity of care, so that you are feeling so that you are involved and your client isn't feeling like they have to exit the therapy with you in order to engage in this treatment modality. So the first tier is the wellness partners. And what wellness partners are is if you a therapist, you think that your client might benefit from this treatment modality, you can get in touch with us, and we would talk about whether the client, this was an appropriate treatment modality, and if it was a green flag, then there may be a possibility of if it was really beneficial to the client from a trust container perspective, that it might be possible for the therapist to attend either in person or remotely during a medicine session, if that would help the client. I'm framing it as a possibility because we have to check to see if the client wants to do a low dose. It might be a little disconcerting with there being 2 therapists there, and it's the lead therapist that is the one that is supposed to be taking the lead with the talk therapy. So there have to be some exploration as to whether that would be appropriate to have the therapist there in a low dose. For a high dose, there could be the possibility of the client's therapist fulfilling the role of what's called the compassionate witness, which is there holding space, if that helps the client feel safe. What we would also do in this scenario, whether the therapist is participating actively in the actual medicine session or not, we will provide a note or have a call with the therapist after the medicine sessions are finished in order to inform about how the sessions went and what areas came up in order to help them assist the client in furthering integration therapy. Integration therapy is a little different than regular therapy. We do less. It is about us helping the client make sense of their journey as opposed to us directing it and assigning meaning. And so we would provide a little bit of direction of what that looks like to the therapist so that they are able to continue deepening that work with their own therapy style as well. We also would be available for a consultation if needed throughout that process and following that. The next level of therapists are therapists that have some training or are currently taking training in psychedelic-assisted therapy. One thing I'm quite happy about with the Atmosina model is they will accept training from other organizations as long as it is a training organization that is recognized. So you don't have to take the training with them. But if someone is just starting out, then the therapists have an opportunity to be more involved, to actually to sit in for both of the low dose or the high dose sessions. And the same thing with the summary note being provided afterwards, and we would be open for consultations going forward. But it helps the client potentially to feel better supported, to have you there with them. And it also is giving you the firsthand experience of what they were going through in their medicine journey. It also could be a possibility to attend remotely, and that would go for the previous tier as well. That in many of the high dose medicine sessions, there isn't a lot actively going on until the end. When they're coming out of the medicine, frequently there's a desire to start the integration process right away and a reporting of what they had experienced. And so that a therapist, you could be attending via computer screen. We also could give you, with the client's consent, a recording of the integration portion that happens immediately afterwards, as long as the client has consented to us recording that point. But you'd be able to, if you're doing your own training in psychedelic-assisted therapy, then you'd be able to be involved a little more hands-on in that whole process. The next tier that we have is if you are a trained psychedelic-assisted therapist. And what happens in this model is that you are allowed to fully use our infrastructure and conduct all of the therapy sessions yourself. And what that looks like is our model is that before a medicine session, there will be at least one preparation therapy session with the client. Then there will be an intention setting therapy session, ideally within a few days of the actual medicine session. Your client will, here, I'm going to jump over. You also would be, then you would be the lead therapist and in the room with the client during the medicine session, either a low dose and a talk therapy session or the high dose. And then you would continue to do the integration therapy work with the client afterwards. What would have happened before that is you would have gotten in touch with us. Typically, you would speak with me first so that we can have a sense of whether your client meets the criteria for this treatment modality. Then we would put your client in touch with our nurse, one of our nurses, to have a free 30-minute info call. And Harpreet is going to take you through what the nursing role is after. But that's just, information gathering and an initial screening. And your client is able to ask questions. And then if it's a green light from there, Then we would send documentation to your client that they would fill out these measures, the assessments that I was talking about, as well as a pretty thorough medical intake form that canvasses with your client their sensitivity to substances, any previous experience with psychedelics. We also have a form that we send them about trauma, so we can have some, so you would have some sense of what might come up if you aren't already aware of it, but so that we know on our end a little more about what might come up for the client. So there's a lot of information beforehand. Then what the next step is, if your client wants to go forward, is they go through a 60 to 90 minute med psych assessment with our doctor or nurse practitioner. And if that is a green light, then we would facilitate the booking of the medicine sessions for you and your client. And again, we would, we are there to assist you and your client, and Harpreet is going to go through, as I said, and take you through a little more of what that process looks like. Okay, I think we can, yeah. So this is, the co-care model is creating an opportunity for you to offer this as a treatment modality for your own clients, and then they return back to therapy with you. And this is, and it helps your client feel supported through the whole process, even if it is just a referral and you aren't involved, all the way down to, of course, if you are going to be the lead therapist after having done some training, then you are just taking advantage of our infrastructure and engaging with your client while they try this new treatment modality. Yes, designed to support your work, not replace it. Absolutely. I know that, in the past, I have referred clients out for, EMDR or so some, or that type of thing, another treatment modality for a client. And I know sometimes my clients can feel like I'm pushing them to the side or something, and there needs to be a fair amount of time that's, spent in making sure that they understand that this is just an opportunity for them to explore a different type of therapy. And of course, that they're welcome to come back to me at any point, but we're just reinforcing that and making it clear in this. And because there are many clients that have some question or concern about psychedelics because of all the stuff, the misinformation that they have written or they've read about before, and because maybe they've never tried a psychedelic substance before. So that's why it's really important to have as much care and support as possible while they're going through this. Okay. So now what I'm just going to talk sorry, I thought there was another slide. We'll go back. So what I'm also just going to talk about is, don't pay attention to the slides right now. There we go. So one of the things that at Messina does is, if you are interested in training with them, is they provide training at all different levels. And we are happy to connect you to at Messina if you want to start taking training in this, so that you are able to eventually offer this treatment modality to your clients. It is coming. It's globally, the results are showing positive outcomes, unlike any previous treatment modality for a certain population of our clients, typically, trauma, treatment-resistant conditions. The Canadian government is a little more on the forefront in allowing things. Things are happening in the States. You might have seen that some substances are now allowed to, are going to get FDA expedited processing so that they can be more available. And more research can be done. So I really think, and there's more clients asking about this, I really think that it's important for as many therapists as possible to get trained in this so that we are ready to provide this treatment where necessary for certain clients. So we can provide information, connect you to Atmasina if you want, and you can explore what their training programs are. I think that their course is online, and with some live Zoom presentations, but it's something that you can do typically on a self-directed scale. There also are other training organizations that, I'd be happy to give you the names of. It doesn't have to be Atmasina. Theracell is one, Roots to Thrive. There's a number of other organizations. I'll also throw out that training experience that I first did, the ketamine learning experience that is conducted by Mark and Susan, they are sort of known as the ketamine gurus. They teach the ketamine portion in many different training organizations. And they're in their 70s and they know their stuff and they do a beautiful job of building this trust container. And something also that is highly recommended in the psychedelic-assisted therapy world is that the practitioners try the medicine themselves. This isn't the type of treatment modality that I believe you can truly get informed consent with unless you've tried it yourself, so you can have some sense of what it's like and what is possible, so you can help explain that to your client. So if, as a therapist, whether you decide to refer clients or not, you would like to experience this yourself, also feel free to get in touch with us, and I'd be happy to connect you with Mark and Susan in order to attend one of their 5-day residential trainings, and it takes place in Brantford, Ontario. It's something that once you try it, then you'll have an understanding of just what is possible with this treatment modality, and likely a better sense of which of your clients would benefit from this. Yes, so and also, what is really important as well is having a trauma-informed approach with your clients if they are undergoing psychedelic-assisted therapy. The psychedelics tend to make us a little more malleable, a little more suggestible, and a little more in tune with energetic presentation. So being aware of the energy we might be putting out with the client and how to hold energetic space is a very important part of psychedelic-assisted therapy, as well as somatics and, of course, your own therapy work, so that you can be aware if there is any countertransference coming out, because they will be able to feel it typically. It's possible for them to feel it in a medicine session, and we want to make sure that we are building this trust container at every step of the process. So I think that's good for me. Let's move over to Harpreet and the nursing portion of this.
Thank you, Dawn. That was really informative, and I'll take it from here and walk everyone through what the nursing team's involvement looks like at every stage of the client's journey with us. So as the therapist working alongside the Port Credit therapy team, you do have the full support of our nursing staff throughout the many stages of the co-care journey. So today I want to give you a thorough picture of exactly what that looks like, and we'll take a closer look at what the nurses at our center actually do. So not just the clinical tasks, but a full scope of how we show up for the clients as well as you, the co-care therapist. So at Port Credit Therapy Center, our nurses do have a strong involvement with the care team. We're not just operating in a silo. We're working very closely with co-care therapist, our clinical director, Dawn, as well as our prescribers, which could be a medical doctor or nurse practitioner. And what really defines our approach is the thing that we all come back to. Our nurses are trauma informed. As Dawn said, we don't have that rigidity in many ways we see in both nursing and medicine. And the trauma informed approach is really something that we actively embody in how we communicate with our clients, how we create space, and how we show up on treatment day as well. So our role is built around a few key points that I'll go over today in detail. And the reason I'm framing it with these touch points is that I want you to walk away today with a really clear picture of exactly what we're doing in this process and where you fit in as the co-care therapist. So the first touch point is we do offer a 30-minute info call, and that allows the client to ask any questions and learn more about ketamine-assisted therapy or psychedelic-assisted therapy. It also allows them to address any concerns they might have. We come with a lot of curiosities as well. And our goal here is to ensure the client feels both informed and supported as they move through the process. The info call also is an opportunity for us nurses to complete the initial screening. We do ask a set of questions to make sure the client doesn't have any clear contraindications, and this will confirm if it's appropriate and safe for the client to access treatment further. If after this info call, the client is ready to proceed and they are clear of contraindications, that would mean that the next step is to schedule a medical psychological or med psych assessment with our prescriber. So our prescriber, again, is either a physician or nurse practitioner, and what they do is complete a 60 to 90-minute in-depth evaluation, and they're going over the client's medical history and also determining the best treatment for the client and suggesting a tailored treatment plan. We also extend invitations to both the client and therapist to visit our office and orientate themselves to the environment and become familiar with our space, and also meet members of the team if they are available. Also, one thing that's really important to mention is that Dawn does schedule a consultation call with the co-care therapist, and this gives us a sense of your experience with ketamine-assisted therapy and gain a sense of where you're coming from as well as a therapist. And it also helps determine together what kind of support would be beneficial to the client. So perhaps it's ketamine-assisted therapy. We also do offer other services at the center that also may be potentially a good fit. And this conversation can take place either before or after the info call. Typically, it is before. And it's a flexible and guided conversation about what best serves the client's care. So I want to emphasize the priority we place is really around ongoing communication and ensuring that you as the co-care therapist are feeling engaged and part of the process. So during the day of treatment, the nurses have quite a few things that they work through. So when you and your client do arrive to the center, we are there to greet the both of you, and we will orientate you to the space as well as get you settled into the treatment room. We do help with any intake forms or consent forms, or just consent forms really, and make sure all the paperwork is our responsibility, and that's not something that you need to take on as a therapist as an additional task or stressor. So that allows the co-care therapist to stay fully present with the client from the moment you walk in. We really try to take off as much of the administrative weight off your plate as much as possible, and that is something that we do with the intention of making sure that you're able to focus on the actual ketamine-assisted therapy aspect of care. So from there, on the day of treatment, of course, we administer the ketamine, we do take vitals, and that is something that we report back to our physician, who is also on site, providing additional medical oversight. So from a medical safety standpoint, you never really have to worry about managing the clinical side of things. A nurse, as well as a prescriber, is always on site to support you and your client as well. So the nurse's role, as mentioned, is also to support the client, ensuring that their vitals are ready to go. They're in a safe space, physically and emotionally as well, to proceed with ketamine-assisted therapy in that moment. And if there's anything that is coming up, sometimes a client has what we call white coat syndrome. They're feeling a little bit anxious and their blood pressure might be higher than what they normally sit at. We are medically equipped with medications to make sure that the client can have any adverse reactions or even symptoms well managed before, during, as well as after treatment as well. And throughout the session, we're present as an extra set of hands. For example, if there's something that you need, perhaps it's practical in nature, maybe you need to use the washroom while your client is in a psychedelic session, we're there to step in as an extra set of hands. So if there's ever a point you need to step away briefly, the nurse can step in and hold space for the clients. And at no point is the client ever alone. The nurses also play a role in patient education. So with the ketamine administration, there is some on-site support that we provide. And we also have an integration booklet that we do send to the clients. It's very detailed, over 20 pages, with a lot of supports, resources, and tools a client can use to either prepare, but also to integrate their experiences that they have. And we also always end our treatment sessions with snacks and a non-caffeinated tea for our clients. That is something I find that they really do look forward to, especially after a few hours of having to fast to prepare for the treatment. And also it's not just supportive, but it does help them feel a little bit more grounded and kind of just come back into their body in whichever way that is. We also send them home with a journal so they can track their mood or any insights that do come up. And that is a great way for the clients to bring up certain things that perhaps they might otherwise forget to bring up in integration therapy as well. So once treatment is done, our role as the nurse doesn't just end there. We do offer ongoing support. And I want to make sure that we just go over a little bit of what that entails. So before treatment begins, again, our clients do receive an integration booklet, and as well as treatment and discharge care instructions through email. And this is something we send as part of the process of not necessarily onboarding, but preparation for the client so that they feel supported in preparing for their experience as well. And 24 hours after a treatment session, our nurses do schedule a call with the clients. We want to make sure that their mood is feeling okay, or just at least checking in to see how they're feeling, whichever way that is, and just really making sure they are sleeping well, as well as their physical symptoms are managed. So in rare occurrences, sometimes the client might report feeling nausea, headache, perhaps excessive hunger, or feeling like they have a dry mouth. These symptoms tend to be common, and this is something we can support the client through so that they're able to prioritize their integration rather than having to navigate their own symptom management. It's also a touch point for us to see how the clients are doing after treatment. And this is something we report back to the care team to see if there perhaps needs to be an adjustment in dosing or better preparation for their next treatment session around symptoms, as well as any concerns that they have addressed. And of course, beyond that, our team is always accessible. The co-care therapist is in constant communication with our team, and they're able to ask any questions at any point in the process. And that is also true for the client as well. And of course, if at any point there is something that there's uncertainty around and you would like to ask questions, there's always an opportunity to schedule a call with us. There is no point where there is a limit of how much communication we can get down to. We really try to be as reachable as we possibly can. Oops, sorry, I'm having a error here. And our client's care is a shared journey. So I want to speak directly to you as the therapist for a moment here, where we really just want to emphasize our role is not to work around you, it is to work alongside you. So the nurses are there to support you as a co-care therapist and help hold therapeutic space for you while you take care of your client as well. That means if there's anything that needs to be done, of course, we are there to support you through the entirety of the session. And if, again, you need to step away, we are there to help you as well. And I really do want to just return to the trauma-informed piece, just because it is an important aspect of the care we provide. It is one thing that does shape how we engage very much throughout the team. So your client's nervous system, their sense of safety, and their capacity to trust. And these are things that we all actively attune ourselves to and make sure the client is feeling supported, not just on treatment day, but throughout the entirety of their care with us. And we also provide documentation or any communications with the client to the therapist, and we try to be consistent and as transparent as possible. So at no point are you feeling out of the loop regarding your own client. So again, just to briefly summarize, we do start with an info call where we screen for contraindications. We walk the client through the process of what to expect, and we begin to establish the trust from the info call. And from there, we do schedule a med-psych assessment and start scheduling a treatment day for when the client's ready to proceed. Following treatment, every client does receive the 24-hour follow-up call from the nurse. And again, beyond that, our team continues to remain accessible and communicative. So this is the overall structure with the co-care model. Co-care is a collaborative model of care, meaning that you as a therapist are bringing in your clients, and at Port Credit Therapy Center, we're providing the medical infrastructure and the oversight. So together, that is what we call co-care or collaborative care. And I will say that does bring us to the end of our presentation. I will hand things back to Alex for announcements and Q&A if anyone has. But before I do, I just want to thank everyone for being here and joining us today. And I hope you found this session informative and it gives you something meaningful to reflect on as you consider co-care and how it might be a fit to your practice. Thank you.
And I'm going to jump in before we hand it over to Alex, because I just thought of a few more things as a result of some of the things that Harpreet shared. And there's a really good question, which I will address just in a moment. But first, I just want to point out that, from this trauma-informed approach that we have, there are other ketamine clinics that let me change this, that there are very few ketamine clinics that have the doctor or nurse practitioner on site. Often they are just monitoring remotely, and the nurse is the one that is overseeing. And if there is an emergency, then the nurse would call the doctor, and the doctor or nurse practitioner would prescribe something. But our doctor really feels it's important to be there. And most of the clients really appreciate that, or all of the clients really appreciate that, knowing that just outside the door, in case something should happen, there is support. As well, as we've said, we don't ever leave the client alone. And again, there are some ketamine treatments where the client is in a room by themselves and there's a camera with a nurse, or a nurse is monitoring cameras that are in different rooms, just watching what's going on. And again, we strongly believe that it is important to have someone with the client at all times, whether it is you as the therapist, or in combination with us, or with us totally. We carve out for the medicine session days. Ketamine is well suited for clinic because it is one of the shortest acting of the psychedelics. It typically lasts for, the effect of the medicine typically lasts for 45 to 90 minutes. But what we do is we carve out 3 hours when you are going to come with your client, so that first your client does not feel rushed. This is part of supporting this trust container. so that there's time for the client to talk with you or talk with our nurse about any nervousness they may be feeling, just being able to vocalize it or ask any questions. We also, from this inner healing intelligence place, we also check in with, we include the client in the process. So our doctor might be suggesting a certain dosage, but then we'll say, how does that feel to the client? And the client can then say, that feels okay, or it feels too much, or it feels too low. And we will take that in so that the clients are feeling that, know that they have a say in this whole process and they aren't just being done to, which often is what happens in the medical system. Okay, so something that I neglected to talk about, and thank you so much, Ivana, for your question, is while ketamine is the main psychedelic that we use and the most easily accessible, in Ontario, it also is possible through what's called a special access permit application to Health Canada, treatment-resistant anxiety, major depressive disorder, treatment-resistant trauma, or end-of-life anxiety. It is possible for psilocybin to be allowed, or for the case of a diagnosis of PTSD, for MDMA to be allowed. What happens with an SAP application, and this, you can refer your clients for this as well and be involved, the same levels that we've been talking about. The difference with this is the doctor needs to, they make the application to Health Canada, and it is quite an involved application. And there is a fee for the doctor to do that, and there is no guarantee that Health Canada is going to approve it. And currently the state of affairs is they are turning down significantly more than they are approving. Part of that can have something to do with how the application is filled out, if they're not getting enough of the information, but there is a bottleneck here. There has even been situations where people have been approved for MAID, but denied psilocybin treatment. Obviously, they have a terminal illness if they've been approved for MAID, but you know, there's still some problem there. What would happen though is, well, and also with the SAP application, it typically takes around 2 months to find out if there's approval. We currently have an SAP application before Health Canada, and I think we're just hitting 8 weeks right now. So, you know, fingers crossed that they are going to approve this. The question that Ivana had put in was about, in particular, MDMA and approximate costing. When there is an SAP application, we have to use the government-approved supplier of the medications, the MDMA or the psilocybin. And obviously, these are clean, uncontaminated sources. They have been tested, created in a lab. Even the psilocybin is a synthetic as opposed to natural mushrooms. The difference with psilocybin or an MDMA medicine experience is it's much longer. Typically, we're looking at 5 to 6 hours when the client is in the medicine journey. And there are 2 people with the client at all times. This would be an opportunity where there would be, if you aren't trained as a psychedelic-assisted therapist, that you could be there as the compassionate witness and also able to spell each other off. With a 5 to 6 hour medicine session, we're going to have a nutrition break and a bathroom break on occasion, and it's all about someone being there to assist the client. The approximate cost for MDMA is, I'm not the financial person, but somewhere in the range of about $5,000. The Health Canada for MDMA, they provide enough MDMA for up to three medicine sessions. for that amount. But it also is, I think you can probably have a sense from what we've been talking about, it is very labor intensive. There are a lot of people hours where your clients are being supported for many hours. You would, just to sort of add that in, you would be, if you're the primary therapist, you would be the one that is billing the client. We wouldn't have anything to do with that. The psilocybin treatment, the government tends to only give enough medicine for one medicine session. However, we've been told that if the doctor is able to justify why enough medicine for 2 dosing sessions is required, then they can do that. But that's sort of, yeah, that's what's available to us with that, and it takes a much longer process, but it's all the same program or the same process that we're following. There are preparation therapy sessions, there are intention setting therapy session, and the integration afterwards is very, very important. Yeah, so I don't know if that answers your question, Ivana, or if there's something else, and if anybody else has. Okay, here we go. Harada, T1 is only so. The typical with ketamine, I'll tell you how we have things set up. In that there is the cost for the med psych assessment for your client is $350, which goes directly to the MD. OHIP covers virtually none of this unless it's done in a hospital setting, and typically they are just okaying IV ketamine without a therapist there. So that is the first cost. Just look at your question. And then what our process is in the info call, our nurses will explain what the costs are. And what we have typically with ketamine, we are finding that clients typically need to have 6 to 8 medicine sessions in order for there to be sustainable change. And one way of looking at this that I quite like is, that I hadn't mentioned before, is all of these substances, ketamine, MDMA, and definitely ketamine, create an enhanced state of neuroplasticity, which allows new neural pathways to be created and facilitates us unhooking from the reinforced ruts of neural pathways of anxious thinking, of depression, of trauma responses. And one of the analogies that gets thrown around is we have a regular route that we are taking, and this is the rigid neural pathway that we have been, conducting our life in. Having the psychedelic substance in the enhanced neuroplasticity is like, a fresh layer of snow, and we can then create new neural pathways much quicker and easier. And this is where the integration comes in, because we need to reinforce that new neural pathway all different ways, and the subsequent medicine sessions facilitate that in the reinforcing that new neural pathway. We have noticed that with one medicine session that a client can feel some immediate relief, but it only lasts for a few months, and then they slip back into the old neural pathway again. So all of that to be said, typically it's 4 to 8, 6 to 8 medicine sessions, typically scheduled weekly or bi-weekly, or we're also, looking at maybe 4 sessions and then a bit of a break and then another 4 sessions. Part of the problem with this is because it's such a new emerging field, there haven't been enough studies, clinical trials, and research studies to determine absolute best practices. With ketamine in particular, it's been around since the 1960s. And so the drug companies can't get a patent other than S-ketamine, which is Spravato. I can talk about later. But so these clinical trials are like $110 million, I've learned. And so that's part of where we need big pharma to come in and conduct these studies so that we are able to determine best practices. But right now, there's still a lot of let's see what's happening and the sharing of information within the whole psychedelic community to be able to figure out what works best. I think, just sort of off the top of my head, the first medicine session, which includes the med psych assessment, and it also includes the preparation and intention setting session and the integration session after, and the medicine session. The first session is in the range of about $1,500, $1,600. And then subsequent medicine sessions are about half that price because we aren't doing the preparation into therapy session and not an intention setting that off because the client already has awareness of that. And so that we take a little bit of time before the actual medicine session to revisit intentions. If you are the co-therapist, or sorry, if you're trained and you're going to do the whole thing yourself, then our fee is very reasonable. It's the $350 for the med psych assessment, which is good for 6 months, and any medicine sessions through that 6 months. Then the cost to your client to use our space, to have the medical team there, the nursing support, the MD support, the integration booklet, the follow-up care is $350 per dosing day. You would be billing your client yourself for your own therapy sessions. The other thing that we assist with is the way that we structure the treatment plan is we break out the therapy sessions in a way that can provide maximum coverage for your clients that have benefits that will cover therapy. So it is possible if someone has a very generous benefit plan, then a significant portion of that fee can be submitted to their insurer and covered. I think did I answer all of your questions, Gerardo? I guess one more. If someone doesn't have enough training, if they are going to be you as a therapist is going to be participating, but you're not the lead therapist, then that would be something that you and your client would discuss. What if you were going to be attending, what you would charge them to be there, and you would take care of that on your own. We don't have anything to do with that. For the co-care, the coming in, the fee for the $350, that we engage with your client and they pay us directly, so you don't have to get involved in any of that either. You can also just speak up, Gerardo, if you would like.
Yes, sorry, I was just grading. Yes, if the 350 is for the initial session and the following session.
Yes, so for each medicine session, it's $350 to use you have the room for 3 hours, the nursing, and the doctor doesn't stay for the full 3 hours. The nurse is there for the 3 hours. The doctor tends to stay typically about an hour, immediately pre-dosing and then while the medicine is taking effect. Yeah.
And the following question is in case that I have a client, I already have training. So if I have a client, do I have to talk to you first just to address my credentials and everything?
Yes.
Okay.
Yeah, you would start with just getting in touch with us. You and I would have a call and, just so I can get a sense of what you're looking for and, what your training is. And it's great that you're trained already. It's
yes.
And, then we'd give you, a little more information. We also, and also the medicine sessions do start to get booked up. We are looking for a nurse practitioner to also, so that we have 2 practitioners and more availability. Right now, it's sort of a day and a half, 2 days a week is all we're able to provide because of our MD's availability right now. So we are looking to increase that. But when we're looking at scheduling 6 to 8 medicine sessions, then the scheduling can be a little complicated. So we assist with that as well. So there's a lot of back and forth as to your availability, your client's availability, and our medical team's availability.
Perfect. Thank you very much, Dawn.
Okay. Anybody else have anything that's coming up for them? A comment or a question? Happy to answer. And maybe if not, or Alex, or while you're thinking, if there's anything, maybe Alex, you can go to your piece and just feel free to jump in, raise a hand, or put a question in the chat if there's something that comes up for you.
Yeah, so we're reaching the end of the session, and first and foremost, I want to thank you all so much for being here and also for your participation and your presence in this conversation. We'll be sending out a recording of today's session, so there's a chance to revisit anything or spend more time with what resonated. And of course, if any questions do come up after this, which they often do with such a big topic, you'll also receive the contact information for the Atmasina team in the follow-up email. And of course, you're always welcome to reach out to us if there's anything that arises or if you'd like to continue the conversation in some degree. And just so you're aware, we have an upcoming couples therapy webinar happening this Tuesday in the evening. You can find the links for that on our social media, like our Instagram, our Facebook, and even on the website. So keep an eye out for that if you'd like to stay connected in that respect. And we'll also be sharing more about our May webinar that we have planned. The announcement's yet to come, but that's in the next week or so. But it's going to be focused on personality disorders, so stay tuned for that announcement as well. And just to close up, thank you for being here. Take good care, and we hope to see you again soon.
Okay, thank you, everybody. Appreciate seeing you all. And yeah, as they've said, get in touch if you have any questions or want more information. Okay.
Thank you. Bye.
Hey, Bill, nice to see you.
Good to be seen.